Kitale is an agricultural town in the western sides of Kenya. On the outskirts of Kitale town lies Kitale District Hospital, a level 4 hospital constructed in 1936 to serve the district, now Trans Nzoia County, partly Bungoma and Uasin Gishu counties, West Pokot, Elgeyo Marakwet, and even eastern Uganda. Residents of the two counties have sought medical care from the facility, which has seen little change over the stretch of time it has been in existence. Its current state is horrible, squeezed, neglected, and barely serving the people within the county. The hospital is given in to old age and lacks the capacity to meet the ever-rising demand for healthcare services from the residents of the county. The hospital has at least 3 patients sharing a bed at any one time, with children and adults sharing beds in the ward.
This hospital was started in 1936, and at that time it was meant to serve a very small population. But with the time the population has increased, and at the same time the buildings have become very old, debilitated, and very difficult even now to do any repairs on those buildings. We have had so many buildings within the compound. Now it's very difficult even to have any other building within the same compound. Kitale has 1 million population, but we also serve neighboring counties like West Pokot, Marakwet. We serve parts of Uasin Gishu, parts of Bungoma, parts of eastern Uganda. We actually serve them here. So this population has increased and has put a lot of pressure on the hospital and the facilities.
People are not satisfied because of the services that are offered, and not because the health care workers cannot offer the services, but the infrastructure is one thing. Also is the poor morale of the workers. So when you're working in a place where people are so crowded and everywhere, it becomes very difficult to even motivate staff.
Physical infrastructure at the hospital is in a sorry condition, with bed capacity stretched to the limit. This has been fueled by an already exploded population.
Patients, they share the bed as 3-3, and at times they go up to 4.
In the wards, our bed capacity is around 250, but we normally have patients who even go to about 360 in some days. So patients have been forced to share beds, and some even sleep on the floor, because our policy in the hospital is that we attend to all the patients who come. We don't turn away anyone. So we'd rather admit a patient who sleeps on the floor and we treat.
Long queues of sick people waiting their turn to see the doctor are common most days of the week.
We see around, especially on Mondays where we have very busy days, we see about between 500 to 600 patients in the outpatient department. And most of the times we normally have so much congestion around the outpatient delivery service points.
Trans Nzoia County has about 78 health institutions, in among them 2 district hospitals, 2 sub-district hospitals, and 33 dispensaries. The county has 7 health centers, 28 medical clinics, and about 6 nursing homes. Being the only public hospital within a large radius, with most of the population being peasant farmers and therefore cannot afford private medical care, which is very costly, all this populace seek medical services from the facility. This has resorted to a long waiting list of patients waiting to be served at the facility.
Nilifika hapa saa 2 mpaka saa 4 sijatibu.
Nilikuwa hapo kwanza mwezi wa 8 tarehe 10 kwa sababu ya mtoto. Alishtuka tu. Akaanza kusimia.
A look around the hospital and one will be horrified if the facility is an instrument of healthcare, or is it a health hazard on its own? All the patients are processed in the same way, with no set facilities for infectious diseases or mental and psychological sections from the regular inpatient and outpatient processing facility. Specialized facilities such as Bonds Unit, Renal or Kidneys Unit, Cancer Treatment, Eye Patient Unit, Surgical Facilities, psychiatric and mental health department are all missing in the current Kitale District Hospital. As a result, there is no privacy while processing patients.
Our examination rooms are really small. There's no privacy. And on top of that, there are no specialized clinics where we should see specialized clinics like surgical, medical, pediatrics, and gynae.
Infection control is also an issue because when you are doing the floor, when someone is sleeping on the floor, people want to clean. It becomes very difficult to tell a very sick patient on the floor to move that you want to clean.
Watu katika kaunti ya Trans Nzoia akiwa na ugonjwa kama wa roho, upasuaji, lazima aende Kenyatta.
Kupata madawa ndio problem. Saa zingine tunanunua madawa nje, alafu tunawekewa kwa bili. Alafu sasa bili iko juu. Na hapa zati ni watu wengi tunajiweza, tuko maskini.
Kuja hapa unanunua dawa, unatibiwa. Hapo tu kutibiwa tu na daktari, lakini vitu zingine zote unanunua.
Shida nimepitia hapa, madawa ya kutosha hamna hapo hospitali. Inabidi mwenyewe upike mfukoni, kama una pesa yako ya kununua dawa, inabidi mtoto anasapotisha maisha.
The populations we are serving is much higher than the drugs that we normally get. What we don't have in the hospital based on what has been procured, probably the patients have to source from outside. But majorly we normally try to keep the essential medications with us.
Due to tremendous population growth over the years, the hospital has been experiencing challenges serving its populace, evident in the disparities shown in comparison to national trends. In maternal and health care, full immunization stands at 42.5%, while the nation stands at 82%. Births delivered at a health facility in Kenya stands at 45%, while Trans Nzoia County is at 22%. Contraceptive prevalence in the county is at a low of 27% compared to 45% nationally. Distribution of human resources for healthcare in the county is as follows: 42 nurses for every 100,000 people, 5 doctors for every 100,000 people, 6 clinical officers for every 100,000 people.
Huduma ya hapa ni nzuri, ni madaktari ni wachache.
Mimi niko na mtoto wa sikose. Jaribu kutuangalia sana, especially sisi watu wenye tuko chini na watoto wetu wako na ugonjwa sugu.
Residents of Trans Nzoia County mostly rely on motorbikes as a major form of public transport. Most of the motorbike operators are unskilled and poorly trained, resulting to frequent fatal accidents. Victims of these accidents are often rushed to this hospital, only to poor reception since there is no emergency unit that is dedicated to cater for such cases. The very victims have to be crumped up in the same shared beds with other patients since there is no more room left to accommodate them.
Niko na pikipiki Friday. Nimekaa hapo wiki moja na nusu.
I can confidently say that we have a new emergency room, but it's just started being operational the other day. But as far as the wards, we don't have specific wards for patients with burns. And so in most of the cases, we still mix surgical patients and the burns patients in the wards.
As a result of the strain of the population's overcrowding to the facilities at the hospital, sanitation conditions of the hospital are at a shocking state. A walk down the hallways, one has to make every effort to fight off the stinking smell from the terrible sanitary facilities within the hospital, posing more health risks rather than offering a solution. It is difficult to effect infection control on the hospital linen, as patients and visitors to the hospital share cloth lines. The hospital has outlived its initial plan of serving 5,000 people, and since it consists mainly of old architectural structures, it poses health risks from asbestos roofs, which were banned by the government since breathing in asbestos fibers can cause asbestosis and lung cancer. Moreover, the architecture of the hospital poses constraints on any expansion attempts to meet the growing demand. Access to healthcare is a fundamental human right every Kenyan citizen is entitled to. Healthcare offered in the best possible condition. For this reason, Trans Nzoia County is in dire need of a hospital, a better equipped facility to handle emergency and specialized cases, a hospital that will be a center of hope, a facility that can cater for the current population and have room for coming generation, a hospital with functional structures rather than historical structures. The new referral hospital will have the capacity to serve 5 million people with facilities including a casualty, examination rooms, specialized clinics and increased beds in the wards. A better medical facility means better medical services, reduced mortality rates, and more room for other partners to come in.
We have acquired a new facility which is 70% complete. It is on a 4.5 acres plot. It covers 7,200 square meters, and with a few modifications we are going to cover almost 10,000 square meters.
Ndakana tumeikuwe karibu hapa ili ndio tusipelekwe Eldoret, tusipelekwe sijui wapi.
Hospitali mpya ikijengwa itakuwa manufaa kusaidia watu wengine wenye hawajiwezi, wenye hawana pesa, wenye ikawa pengine hiyo hospitali itawekwa dawa alafu watasaidia watu kutibu.
This proposed facility that is better and modern will not only benefit residents of Trans Nzoia, but also ease pressure on the Eldoret-based Moi Teaching and Referral Hospital.